Has your dream of starting a family become a painful and frustrating nightmare? Are you sick of jumping from specialist to specialist, trying to understand the root of your fertility issues? An astounding 3.5 million people in the UK face challenges with fertility, with about 1 in 5 couples struggling with unexplained infertility. Fortunately, there are natural, minimally invasive treatments in traditional Chinese medicine that can help couples who are struggling to conceive. If you want to learn more about the use of acupuncture to treat infertility, keep watching. Does acupuncture work? Traditional Chinese medicine sees infertility as the result of an imbalance or disruption within the body. The belief is that resolving this disruption and clearing any blood circulation blockages will correct the problem by restoring balance to the endocrine system. If you are hesitant about the effectiveness of acupuncture for treating infertility, let us illustrate with some research findings. A study by the National Center for Biotechnology Information, NCBI, found that 8 to 12% of couples looking to become pregnant face unexplained infertility issues. Researchers analyzed the case of a 28-year-old couple that had been trying to conceive. They had regular acupuncture treatment, and the woman had ovarian cysts that disappeared after having 7 acupuncture sessions for infertility treatments, and she was successful in getting pregnant. Another study from the University of Maryland's School of Medicine compiled information on 1,366 women with unexplained infertility issues. The results show that, when acupuncture was provided on the same day the embryo was transferred, there were significant improvements in pregnancies, continuing pregnancies, and live births. But what role does acupuncture play? Acupuncture has been found to help with infertility issues in several ways. It improves sperm quality and sperm counts, function of the ovaries, balances hormones and the endocrine system. But that is not all. As studies continue to test its effectiveness in helping with infertility, new and promising findings have been identified. Acupuncture may benefit the endometrium lining and promote a healthier blood flow to the uterus. Because of its ability to tap into hormones, it may be able to regulate them, resulting in improved ovulation rates. For years, specialists have discussed the harmful effects excessive amounts of stress has on our health. It is no surprise that stress has also been linked to unexplained infertility. According to PhD Rendine Lewis, when basal body temperature are fluctuating, qi, known as the vital energy that circulates through the body at all times, becomes stagnant in the liver. This is common among women whose cycles vary by month. With the liver and the endocrine affected, it means that acupuncture points for unexplained infertility must be tapped. It is important to know that in moments of intense stress, adrenaline is released. This hinders progesterone, a necessary hormone for fertility. The human body is designed to avoid pregnancy at times of severe stress to keep away from danger. While this was ideal in primitive times, today it is a controlling response to stress from nervous tension. This is why finding a way to control stress and using acupuncture for unexplained infertility are the keys to finding success in pregnancy. Alleviating stress is yet another benefit of acupuncture. So, what can you expect from this treatment? When seeking out TCM acupuncture for unexplained infertility, always choose someone licensed by the British Acupuncture Council or the Association of Traditional Chinese Medicine UK. Once you have found the specialist for you, the treatment is very straightforward. Through the use of flexible, incredibly fine hair-like needles, acupuncture points for unexplained infertility are stimulated. These acupoints which correspond with the energy flow qi in your body. Some patients feel so relaxed that they fell asleep during the treatment. Others may need time to adjust, as it could lead to dizziness or nausea. If you are wondering how long you should undergo acupuncture for infertility, you should know that the number of treatments can vary from case to case, depending on your medical history. Appointments are usually scheduled a week apart. Over time, you will not need to go as frequently for acupuncture success in treating unexplained fertility. Are there any risks? As with any medical treatment, you need to be able to trust your health to qualified professionals. Take the time to research a licensed and experienced acupuncturist that has previously worked with unexplained infertility issues. Choosing someone you feel comfortable with is important. A credentialed acupuncturist will ask about your full medical history, including aspects not directly related with your infertility issues. It's important to disclose this information as certain conditions may raise the risk of complications. Additionally, the only other risk you may run into lies with the needles. Visit the office first to check the level of cleanliness and hygiene. Proper acupuncture needles should always be sterile and disposable, which eliminates any risks of infection. If you have exhausted every alternative and still have no specific infertility diagnosis, seeking out acupuncture could be the answer. Studies show great success in freeing the qi and relieving the stress that might be getting in the way of your efforts. By exploring this possibility, you could finally start the family you have always dreamed of. Hit the subscribe button for more latest videos. You can also check us out on our website www.GinSen-london.com.